Welcome to this new episode. Now we will see the articular approach in relation to all temporomandibular type problems. In relation to the articular approach, I'm interested in drawing your attention to what is the relationship between the mandibular condyle and the temporal bone, and above all, the relation between the disc and the back part, called the retrodiscal lamina. If in the medical history we have understood that the predominant problem of the patient comes from the joint and not the muscles, then we have to create what is called the distraction movement, that is, create space or move the condyle away from the top, which is the temporal bone, therefore trying to give slack to the movement that should make the disc naturally. In particular, we will see the basic maneuver, which is called the inferior glide, that is, an opening downwards. A maneuver that always comes in hand and will be the one that we will teach to the patient to do by himself at home when we go to the sitting maneuvers. The rest of the maneuvers we will see, always based on the inferior glide, consist of adding an anterior component, a lateral component, or in case of an attempt to recapture the disc, as we have seen in the physical examination in reducible disc problems. Then we will do a technique that has 4 phases, as if it was a small square, in which we will try to recapture the disc to place it in the right position. The general premise of this maneuver is, as we can see directly in the model, to place ourselves inside the mouth, since we will always go with the thumb inside, towards the 8th tooth. A second finger will rest on the mandibular branch, and the rest of the fingers will grab the mandible, obviously without hurting the throat. Exactly at this point, we will try to create a small distraction movement at this level.